5 minutes after 11 o'clock. Thank you for tuning in. I think it was a year ago that we got that flamingo that's in our office, right, Robin?
Yeah, it's wonderful.
It's about the time to get another flamingo, isn't it?
It is.
Just about the time. We're going to find out.
Oh.
Well, today I got some lip balm. I just like saying lip balm. Lip balm. Brittany Marthaler is here. She's the communication manager at Ocala Health, and Justin Lamb is here. He's the community relation manager. I'm reading here from Advanced Imaging, and they have invited a couple of guests. Is that right? You are the inviters and they're the invitees? Okay. Dr. Terrance Stone is here. He's a medical director for the Advanced Imaging Centers of Ocala, as well as a diagnostic radiologist and a special interest in women's imaging. I got that interest too. And then Kandi Ellzey, right? Is the imaging technician for Advanced Imaging Centers here in Ocala, and has more than 25 years experience in medical imaging, including the work she did as a 5-year-old, because obviously sorry. You like that, right?
You're 22 today.
Anyway, we're talking about the importance of breast cancer screening. So good morning to everybody.
Good morning.
This is, I guess October is it Breast Cancer Awareness Month or something?
It is.
Yeah. And what does that mean exactly? It means when you have a whole month dedicated to something, does it mean you do more than any time of the year? Or what happens?
We try to raise awareness during the month of October of the importance of early detection and how that plays a role in the treatment of breast cancer. So we use the national recognition of the month really just as an excuse to talk about it.
Just give us
it's kind of like that annual time of year that we say, hey, remember, you should really get your mammograms once per year. So we use it as a platform to talk about it.
Well, it's a good idea, and everybody jumps on that bandwagon. Pink is such a nice color, so we'll jump on that bandwagon.
My favorite crayon.
Pink is my favorite crayon. You know that song? Does anybody know that song by Aerosmith? No? Okay, never mind.
I thought you were just telling us a fact about yourself. I was like,
Sort of
mental note made.
All right, well, Doctor, we'll start with you. Good morning.
Good morning.
At what point, jeez, it's not a very good soundproof window. At what point does a woman come to you?
Well, as a screening, for screening, women will come to us beginning at the age of 40, or depending on if they have a the dude out there with his blower is really
I know. It's
entertaining.
I know.
So basically, if a first-degree relative, meaning your mother, your father, your sister, your brother, your daughter, your son, if they have a history of cancer, in this case, say a mom having cancer at 45, you would come in for screening at 35. So there is some wiggle room in terms of when people are supposed to start. But in general, you start screening mammography at the age of 40.
So you could literally be the first person who tells them that you're concerned about something.
Well, by and large, out of 100 people who come to us for a screening mammogram, about 10% of them will actually be asked to come back for a second look. And in general, that second look is more to prove that something is nothing as opposed to prove that it's something.
Okay.
And the way that I generally say this is that, 10% people will get called back for a second look. And of those 10%, you might have to move on to a biopsy. And basically, oftentimes when you're talking a biopsy, you're not talking you have cancer. We're talking we've gone as far as we can with imaging, and now we truly need to prove whether this is cancer or not.
We need to know. Yeah.
But and in general, about 10% of those people will actually end up with breast cancer. So that's your first shot of coming in, and those are your percentages. Over the lifetime, those percentages change.
Now, if a lady came in a year ago and everything was fine, and she's coming in this year and there's something that you're concerned about, is the fact that it's only been a year, somewhere in that year that it started, is that going to be really good news? I mean, is it usually good news?
Absolutely, because the point is to find these things. We're getting down to the point where we're talking line pairs. We're talking like millimeter-sized or less than millimeter-sized calcifications. The resolution for digital mammography is exquisite. And so the point is that we want to find these things before they get large enough to feel and before they have a chance to spread to other parts parts of the body. So early detection is the entire point. And plus, oftentimes, I mean, we're talking the interventions, if it is a positive situation, the interventions are so much less invasive. They're so much less life-altering when you get them at a very early stage. So you're talking a lumpectomy, not a mastectomy. You're talking, the earlier you can find these things, the better. And so yearly mammography is incredibly important.
Dale, how about the when a person goes for the mammography? Sometimes women say they don't want to because it's uncomfortable. Has there been increases in the comfortability of that as well?
The new digital mammography, you still have compression, but it is not near as bad as what the old machines are. And by old, I mean 10 or 15 years ago, people dreaded coming in for a mammogram.
Yes.
But now that much better, and we have many women say that, this is nothing. I don't know why I got so worked up about it and why I let myself talk myself out of it. It's really not near as bad as it used to be. Imaging is so much better.
And then is there more than one kind of imaging that you can test for the to do the mammogram, or is it just one straight across the board for every woman?
Well, screening mammography is the gold standard. That's where all the research proves. I mean, it has been proven that screening mammography saves lives. So that's a done deal. Now, we do have other imaging, what we call modalities, other ways of looking at the breast that are generally problem-solving techniques. So if you have something that looks like a nodule in the breast, we can send it to ultrasound, and ultrasound looks at the breast in a different way. It uses sound waves, and so it can see things, texture changes in the breast that can prove whether or not this nodule, is it just a fluid collection called, that we, a cyst, that's something that a lot of women have. Cysts, they come, they go. Sometimes they're painful, sometimes they're not. I always make the joke they're like your in-laws. Yeah. But a cyst is nothing, and you can let it go. Whereas under ultrasound, if it looks like a solid lesion, then you start getting into, well, does it look like a scary solid lesion or a not scary solid lesion? And then you can go to biopsy right off the ultrasound, because the ultrasound is exquisite in terms of guiding you for doing these very non-invasive, these very not big and scary types of biopsies. And then sometimes we even will send somebody on for a breast MRI, and there's lots of different reasons to get a breast MRI. One, it can also be a problem-solving technique. If the ultrasound and the mammogram are not really agreeing with each other, you can move on to MRI. It's oftentimes used before surgery in somebody who has a known cancer to look for multifocal and multicentric breast cancer. It can be used after surgery. I mean, there's a number of indications for it.
Wow. So if it's if it's like your in-law, it's a sister-in-law, right? So when my son is 28, so I remember the ultrasound that showed him in my wife's belly.
Right.
Okay? I couldn't tell what it was. My niece now posting pictures on Facebook, you can see the baby's face.
Right.
I'm guessing that's the same advancement that helps you with examining a breast, right?
The equipment has improved immensely, and there are differences in the level of equipment at one facility versus another, and so oftentimes. Sometimes you'll even have somebody come in for a biopsy with outside imaging, and you image them with our equipment, and you're like, oh, no, you don't need a biopsy. Or, yes,
Oh, really?
Yes, you do, yes.
So wow, so it depends on where you go.
Yes, true.
Wow, have the new laws changed where the money goes? I mean, are we seeing some people with inferior equipment? I mean, a hospital obviously would have really good, I would think.
Basically, as the equipment gets newer, it gets better. As with anything, as with your iPod, as with your, just don't bend it. No, sorry. But
don't drop it in the toilet.
Yeah, it's not waterproof yet.
Can we see the results immediately? I mean, you as the technician, can you tell the woman right then and there if she's okay or not?
No, we're not allowed to tell them, but when they come in for a screening,
that must drive them nuts.
It does.
They want to know.
Well, yes, but...
Go ahead.
Well, I mean, if...
Can you wink one time if it's good?
It's the type of thing that if if I need to call you back for something more, if we're doing a workup on you,
Right.
you will be told that, okay, we've called you back for a second look,
Right.
and we'll be able to tell you, no, this is nothing, you're good, check, have a nice day, we'll see you in a year. Or, good.
Before you leave the office, you would know something if you're there for a diagnostic study. But if you're there for just a routine screening, you're usually there and just to have your mammogram, and then you leave before you know the results.
Oh, okay.
Is it quicker now than it used to be, or?
Yes, because we read same day, and so the report goes into voice recognition, and the voice recognition sends it out to the doctor's office.
Wow.
So the turnaround time is very quick. It's not like back in the bad old days where it was a week turnaround time or 3 to 5 days turnaround. The turnaround time is very quick in terms of getting the report to the doctor's office and the letter going out to the patient.
When somebody says aggressive cancer, do you know that right away? Do you know that something's aggressive or not so aggressive?
Well, we have a scale of talking about how scary or not scary a mammogram looks. I mean, on a scale of 1 to 5, you have 1, nothing to talk about. 2 is that cyst that we were talking about, that's nothing, but you have to talk about it. 3 is probably benign findings, by definition, less than 2% chance of malignancy. Now, this is something that you very, very, very much think that this is nothing. But it's not a deadlock. And so what you do is you have that person come back in 6 months, and that's called, and in the mammography world, that's called a short interval follow-up. It's only 6 months, because these are generally very slow-growing tumors, and so 6 months is enough time for us to actually see whether or not it's changed.
Okay.
4 is that's suspicious, stick a needle in it. 5 is scary, scary, get it out, get it out.
Okay.
But talking about something being an aggressive cancer or an invasive cancer, that's what the pathologist has to tell you. You send the tissue to them, and they tell you whether or not this is something that is relatively contained or whether this is something that has spread beyond the duct walls, for example.
Wow.
Do men come in for these kind of tests?
Absolutely. They come in usually with a lump or pain or redness. We usually see one every 2 weeks.
Oh, really? Oh my! I bet they're really scared too.
They are scared. They're not sure what it's going to be or whatever.
But you have such a good demeanor about you. You have to have that when you're giving the test, whether they're men or women, to make them comfortable.
You want to make them feel comfortable. You want to make them feel like you know what you're doing, but you also want to ease their fears, because hopefully it's nothing, but that's why
They joke
there.
with you all the time, don't they? They hide their nervousness with jokes.
Well, but also being a man coming in to what we men oftentimes think of as a women's world
Right.
in terms of mammography, the problem is that there is a significant number of men who do get breast cancer. It is a cancer that men get. And myself personally went through the whole breast lump.
You did?
And had a biopsy and the whole deal. So I've been on both ends of this process. And as a man, it does feel strange going through it, but once you recognize that this is no different than having colon cancer or gallbladder or pancreas, I mean, we're all...
So was yours cancerous?
Mine turned out to be, the $30 word for it is idiopathic gynecomastia, which is a really fancy way of saying, yep, you've got a lump, but it's nothing.
Good.
Oh,
Good. You had
yay.
nothing. Wow. Idiopathic. something.
Idiopathic.
Okay. All right. We need to take a little break, and we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Partly sunny skies today with a shower with thunderstorm in spots, mainly during the afternoon hours over the interior, the high 84 to 88. Partly cloudy tonight, low 69 to 73. Tomorrow, partly sunny with an afternoon shower or thunderstorm, high 86 to 90. For Saturday, clouds and sun with a shower or thunderstorm through early afternoon, the high in the low to mid 80s. From the Florida Weather Center, I'm meteorologist Joe Dunberg.
This weather brought to you by A&A Lockdock. Did you know that most break-ins happen during bad weather because it masks the sound? Don't be another victim. Protect your home and business today. Call A&A Lockdock, 352-867-1965. That's 352-867-1965.
Hi, my name is Dr. Erica Olstein with A Better You Healthcare Acupuncture and Eastern Medicine. Join me Friday, October 10th at 11 a.m. when we do a live acupuncture session right here in the studios of WOCA. Acupuncture is used to treat everything from back pain and migraines to high blood pressure and allergies. We treat the source of your problems, not just your symptoms. For more information, go to abetteryouhealthcare.com. Tune in and call in with your questions Friday, October 10th at 11 a.m. right here on The Source.
All All right, it's 20 minutes. Every time I turn the microphone back on, there's this like hollow sound going on. There it goes. That's better. All right, 20 minutes after 11 o'clock, we're learning, well, basically what to do to prevent breast cancer or to find out whether you have it. And, of course, getting a test is the best way to do that. Your questions are an important part of this. The phone number is 622-WOCA, 622-9622. Dr. Terrance Stone is here, and Kandi Ellzey is here. One of them will be able to answer your questions about the testings that you might need to go through for breast cancer. And Brittany, you said you had a special pricing or something?
We do. During the month of October, as I mentioned, with October being Breast Cancer Awareness, we launched our 4th annual Standing Up to Breast Cancer campaign, where we offer special pricing at our advanced imaging centers. The centralized number for that, if you'd like to go ahead and take this time to put that appointment on your calendar, it's 352-867-9606, and our Pleasant schedulers would be happy to get you scheduled.
So a woman doesn't have to go through their physician to set up a mammogram. They can just call on their own?
For screening.
Well, we prefer that they do come through their provider with a script, but if they do not have one, they can do a
What's called a self-referral.
self-referral.
Oh, okay.
Thank you.
And we have a process by which we make
Right.
sure that those people are taken care of. If something does come amiss, then we have a process by which that they won't fall through the cracks. But you don't have to have a script, but obviously it's preferable because you want your results to go back to a physician, and particularly if something needs to happen as a second step.
And I'm guessing it's covered by insurance, am I right? Is it covered by insurance?
For screening mammograms, yes.
Okay, okay.
In addition, we do have some extended hours this month, a couple Saturdays, and some hours where we'll be staying open a little bit past 6 o'clock to fit anyone in that needs a later evening appointment or a Saturday morning appointment. They can call and speak with the schedulers about that.
Okay.
And now you have the Standing Up to Breast Cancer campaign where we see all those beautiful flamingos around town. When will they be out and about, and how long will they be up?
Well, they've been out since Sunday.
Okay.
We started early. We have quite a few businesses that have joined our campaign this year to help spread the awareness, and we really appreciate that. And they'll be out through the entire month of October, moving around different areas throughout the city. If you don't mind, I'd like to kind of mention some of those locations. This week, they're at Bellevue Veterinary Hospital in Bellevue, Florida, and also over here off of 17th Street at Tri-Eagle Distributors. They'll be at Phillips Chrysler Jeep Dodge Ram next week. Discount days, consignment again. Ocala Hilton, the New Jersey Mike's will be opening next week. Mojo Grill on 17th Street, Heritage Bank on the Boulevard, Georgia Floors Direct, Jenkins Auto Group, the Hyundai location, Longhorn Steakhouse, Pearson Nissan, College of Central Florida, Community Bank and Trust, Florida, and Mary Camp Animal Hospital to round out the end of the month.
All right, all right. We're going to get another one. We need a mate for
We brought
ours.
one in for you.
Oh, you did? All right,
Thank you.
all right.
We'll make it our donation then.
Thank you.
Yeah.
You will have that.
Yeah,
Yes,
I've
and
got
all the proceeds go
Cash.
to Michellogram, which is a local organization that assists women who cannot afford mammograms. So that's the organization that we've
Yeah.
been contributing to
Right.
since the start of this campaign.
And since since their conception, they've provided over 533 screening mammograms to women since 2009, which is equivalent to just over $102,000 raised. So they
Wow.
have no overhead. All the money that comes in goes right back out to help local women.
Oh, that's great.
In our communities, so the money raised here stays here, and they do a phenomenal job. And we have a couple other organizations, such as the Bunko Babes, who really help drive
Right.
awareness for Michellogram and support the cause.
I like those Bunko babies.
Yes, they're a lot of fun.
All right, so a lady comes in and she gets tested, and I'm a little bit confused if she finds out right away that she's okay. That is, I know if she's not okay, she doesn't know right away. But does she know
Well, the workflow that we currently have at our office is that we basically in 24 hours their doctor has a report. If it's same day or next day, the doctor has a report and the patient can call the doc and ask.
And then so celebrate or something.
Exactly.
Are we doing better with? Because I've always been confused about what causes it. Is it what we eat? Is it where we are? I mean, I know there's a genetic element, but aside from that,
there is a genetic element. You're getting into basic biochemistry and genetics, actually, at that point. Smoking is always a bad one. Smoking is it's linked to everything. Quite frankly. But in general, it's part of being human and having breasts.
Well, it's ageless, because my daughter was 16 and she found a lump, and then we went to the doctor, and thank God everything was okay and they were able to make it dissipate. But it's not just for older women; it's for every woman.
Correct, and we get young women coming in. When I was deployed, we actually did. We obviously didn't have mammography, but I used ultrasound in the deployed environment for women. And actually, in Baghdad, I sent one woman home who actually had what we would call a 4 or a 5. So she basically left the theater because of her having breast cancer. But oftentimes, hormonal changes can cause these types of lumps and bumps to come up. Sometimes it's a benign tumor. Fibroadenoma is another $30 word, but it's a very, very common benign tumor that women have. But so yes, it spans the lifespan.
Sometimes a woman can't feel a lump though, but there's something there. It's kind of uncomfortable. How do you speak to that woman when she comes in to do her imaging?
We just tell her that, first of all, we're glad that she's there, because if you have an ache or a pain or a lump or any kind of abnormality, you need to have it investigated. Mm-hmm. So we always encourage them to come in and go see their doctor first. The doctor sends them over to us, and we do the mammogram, and we work with them. If they're in a lot of pain, yes, we still have to compress them in the images, but we do it with a lot of patience and tenderness, I'd like to say. But it's real important that they get that mammogram. And usually from there, they go to ultrasound, and between the two tests, hopefully we can give them some kind of answer that day and kind of relieve them, or at least let them know at least what's going on, because nerves play a factor in that.
It does.
I would imagine, yeah. So, now, Robin used the word dissipate. And is there a way to dissolve it or something, the lump, if it's benign, or does it always have to be cut out? Or
well, sometimes fibroadenomas, to use that as an example, will involute on their own. They'll go away on their own. But oftentimes, you just know that it's there, and that as long as it's, if it's along your bra line, if it's causing you difficulty, then yes, you can actually have it taken out with a lumpectomy. They tend, if they're going to go away on their own, it takes a long time. So generally, it's something that you either live with and eventually goes away, lives with and it doesn't go away, or you're like, this is just not working, and you have that taken out.
I don't know if this is off the topic at all, but every once in a while you read about a celebrity that has had both of her breasts removed just in case.
No, that's not just in case.
Really?
That's somebody who has a BRCA high. It's the BRCA 1 and 2. It's a genetic marker. It is.
So you think that's a good thing?
For patients who meet the criteria for exceedingly high risk for breast cancer and ovarian cancer with those BRCA mutations, then not only is it a reasonable course of action for them to do the bilateral mastectomy, proactively.
But they do it before they have cancer?
Correct. And the reason is that they're at such a high lifetime risk that, let's say they don't do the mastectomy, they end up, or should be, put in a high-risk screening program in which they have, let's say in January, they have their bilateral screening mammogram, and then in June, they should be having a breast MRI. And then so every 6 months, you're going back and forth between those two, because they have such a high lifetime risk that if you're not going to make the choice, and that's a very personal choice as to whether or not to do surgery or do screening, but whichever way you go, I mean, there is an actual legitimate pathway that you would be following.
Wow, and I don't know, I mean, you probably know some ladies who've done it who are not high profile, but the only ones I ever hear about are the high profile ladies.
Well, that's because they're the only ones who are
talking about it?
Talking about it. And actually, I think it's good for them to talk about it because, the one nice thing about celebrity is that you can raise awareness for those things that are important to you personally. And we all have such a wide range of things that are important to us. I'm sorry. Yeah, I see you have something.
No, I'm sorry. I wasn't paying attention to the clock. So we're out of time. Do we want to give some phone numbers and any way that I want our listeners to know that if this has been hitting a chord for you, first of all, the whole thing has been recorded, so you can share it with somebody else or watch it again. It'll be up by 2:00 today. Any numbers we should give?
If you would like to schedule a screening mammogram, the number for advanced imaging, again, is 352-867-9606, and we encourage you to get connected with a primary care physician if you don't already have one. And that number for our consult nurse line is 800-530-1188, and they'll be happy to get you connected.
Which helped Robin last week.
Yes, it did.
Our listeners knew what happened to Robin, so
Your line
she
is
called it.
wonderful.
They said go to the emergency room, and we thought she was having a stroke. Just to recap, anybody who didn't hear, turned out it was Bell's palsy. Now look at her. A week later, it's like perfect again.
Better.
Yeah. She was talking like a pirate the first time. What are you doing, Rob? Why are you talking like that?
Okay, then.
Here we go. Here's the news. No, I'm teasing. Dr. Terrance Stone, thank you for coming in.
Absolutely.
Nice to meet you.
Thank you very much for letting us talk.
You're welcome. And Kandi Ellzey, thank you for coming in. Brittany Marthaler, thank you for coming in.
Thank you.
And Justin Lamb, thank you for coming in.
Yes, sir.
All right, we'll take a little break and we'll be right back.
Hi, I'm Yvette, and I'm here to tell you a few things about ABC Frederick's Appliance. They sell not only new, but used guaranteed appliances.